My name's Alan Weil. I'm Editor-in-Chief of Health Affairs. We're very pleased to be a partner in this event. I want to add my thanks to you all for being here, and particularly my appreciation to Ashish and John for the collegial way we've put this together. We each bring great strengths to this topic, and I think together we do something none of us could do individually, and I want to echo Ashish's comment at the beginning that we hope this is the beginning of more, even if we have to leave the rarefied air of Washington, D.C. and Cambridge, Massachusetts to do so. It is truly my honor to be able to introduce our keynote speaker today. It is often said, just look at the bio. There's so much there, and indeed there is, but I think it's important that you understand, if you don't already, the great credibility and accomplishments of our speaker today, Tony Fauci, who's director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. As you'll hear in his remarks, he served under 5 presidents, which I think is quite relevant to the conversation we've been having already this morning. He was one of the principal architects of the creation of PEPFAR. He's a member of the National Academy of Sciences, the National Academy of Medicine, many awards, including the National Medal of Science and the Presidential Medal of Freedom. Dr. Fauci has 43 honorary doctoral degrees, author, co-editor, editor of more than 1,290 scientific publications. He brings experience and credibility and perspective. Please join me in welcoming Dr. Fauci.
Thank you. Thank you very much. It's a pleasure to be here with you today. I've spoken at after-dinner speeches and intra-dinner speeches, but I've never spoken to a line of people waiting to get their food. So it's nice to have you. Anyway, it's the idea that we are now a few days away from a new administration obviously prompted the really extraordinarily, very enjoyable, and I'm really pleased I had the opportunity to listen to the panel, both of Amy and Ron, and as well as Bill and Dr. Jafari, which really, I think, set the stage for so many of the things that we are going to be dealing with over the coming years. Given, as you heard from the introduction, that I have been around for a while and have had the opportunity and the privilege and the pleasure of serving in 5 administrations, I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today, based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak. And I hope by the end of my relatively short presentation, you will understand why history, the history of the last 32 years that I've been the director of NIAID, will tell the next administration that there's no doubt in anyone's mind that they will be faced with the challenges that their predecessors were faced with. So for those who think that infectious diseases is gone, there's so many people who've made foolhardy statements not knowing at the time that they made them. I usually show a quote from an old surgeon general or an old pundit in infectious disease. So I thought I'd pull this one out from Sir Macfarlane Burnet, who was actually a Nobel Prize-winning immunologist, who made the statement, as many did, to write about infectious diseases is almost to write of something that has passed into history. The most likely forecast about the future of infectious diseases is that it will be very dull, which is really kind of interesting coming from a semi-genius like Macfarlane Burnet. And I think what he did, and the mistake that so many people have made, is something that several of our panelists have already referred to. And that is a failure to look beyond our own borders in the issue of the globality of health issues, not only things that are there that will come here, but surprises that we have. So when I think about infectious diseases, I break it down into a few buckets. the established infectious diseases that we know, and when I say I know, we mean that you could reasonably predict today what the disease burden of morbidity and mortality is going to be next year. In my mind, that's the Tony definition of an established infectious disease. But there are also other issues that we're talking about now, are diseases that are brand new, that we've never seen them before, or much more common, diseases that reemerge. So let's take a very quick look at established infectious disease and show you what I mean. So there are diseases and disease burden, and these are projected every year, and they're almost always right. For example, lower respiratory infections, and these are deaths. There's going to be over 2.5 million deaths. There are about 1.6 to 1.8 million deaths of tuberculosis, hepatitis B and hepatitis C, diarrheal diseases. It is of note that I have HIV/AIDS here on an established infectious disease. When I was giving this lecture, and I'm going to get to it in a moment, it was an emerging infectious disease. And now, after 35 years and 6 months, it is an established infectious disease. So let's take a look at the burden, and then we'll quickly go on to the emerging. So by the last count of that article that came out in Lancet just this past year, if you look at the total of 56 million deaths worldwide each year, about 15% of them are infectious diseases. That used to be 27% when I first started giving this lecture. And what that tells us is some of the advances we've made in vaccinations and antibiotics and what have you. But if you look regionally, it is still the #1 cause of DALYs, which is disability-adjusted life years, which is death plus disability in the developing world in individuals from birth to 49 years old. So it still is a major problem. So that's established infectious diseases. But now we're talking about what an administration might face in regard to emerging diseases. And I'm going to just put them together into newly and re-emerging diseases, and I'll get in a second to what I mean. So from my own personal experiences, why I can say with some confidence that history tells us that we will definitely get surprised in the next few years. So it all started for me when I became director of NIAID, and that was in 1984. And this is the NIH record showing this young immunologist who just took over as the director of NIAID. And over the years from then, as you've heard in the introduction, I've had the opportunity to serve 5 and advise 5 presidents. And these are the 5 presidents, and I'm going to go into the things that I had to advise them about. But before I do that, just to show you the importance of these diseases, this is a picture of me in the very early 80s, one of my first testimonies before a congressional committee. Now, there are 2 aspects about the number I'm going to tell you, and that is that we went back with my ledge office at the NIH, and I've testified, and this is not briefings, these are official testifying before the Congress, either the Senate or the House, since I became director, approximately 250 times. And every single one of those was related one way or another to an emerging infectious disease. It started off with HIV, and then it went up to the last few that we did, that I had the opportunity to do with Tom Frieden and with Sylvia Burwell and others with Zika. And we did about 10 or 12 of those with that. So when I first started and I began to testify, it was right in, because I became director in 1984, and HIV, we first found about it in 1981. So I wanted to testify before the Congress and make the point, this is 32 years ago, that there are emerging infectious diseases. So I drew a map, I sketched it, I'm not that good an artist, and I had my graphics people do it, a sort of a map of the United States of America. And I put on the map this new emerging infectious disease, which is HIV/AIDS. And I take that map, and one way or another, every single time I testify before the Congress, particularly for my budget, almost always for my budget, and I talk about global health and emerging infectious diseases, I add one, sometimes two, sometimes three, either new diseases or re-emerging diseases. And the last time I did that was this past spring. And this is what the map looked like. This is the accumulation of things that have emerged. Sometimes they're blips on the radar screen, and sometimes they're profound. So for me, it started off with Ronald Reagan. And the two that he had is one that was under the radar screen and only years later became, but one that we should have paid more attention to at the time. And I show you this because there's outbreaks that are very profound, acute, and dramatic, like Ebola, like what we've seen with Zika. And then there are outbreaks that may be really subtle. They're happening, and you're not necessarily noticing them. And that's exactly what happened with the first outbreak that I had to deal with. And that was the outbreak of HIV/AIDS, which we first became aware of in 1981 with the now very famous two MMWRs, Morbidity and Mortality Weekly Reports from the CDC, first of 5 gay men, and then a month later of 26 gay men, first in LA, and then in LA, New York, and San Francisco. At the time, we thought this was an American gay disease. We did not know that as we were talking about these two MMWRs, there were likely hundreds of thousands of people in sub-Saharan Africa who were already infected, but nobody noticed it. This was something that actually changed my career, and I talk about it often because as an infectious disease immunologist at the time, I said to myself, this is going to be really, really bad. And I try to get people interested in it, and very few people did, with some exceptions. The CDC certainly was. We were up here. So what I did is I tried to give, I refer to it as my apologia pro vita sua. I could say that in Georgetown because you all take Latin, right? Okay. Which is really an explanation for what you're doing with your life. So I wrote an article and sent it into the New England Journal of Medicine. They rejected it because they said it was too alarmist. So then I sent it to the Annals of Internal Medicine. I wrote it in 1981 in December, and it got published in June of 1982. And I said, because we don't know the cause of this syndrome, any assumption that it's going to remain restricted to a particular segment of our society is an assumption that is truly without scientific basis. And unfortunately, that was one of the more prophetic things that I have said, because if you fast forward now 35 years, when I said this, there were about 125 reported cases of HIV to the CDC. And we didn't even know it was HIV then. We were calling it GRID. Fast forward, and now we have about 80 million cases, about 35 to 40 million deaths, 36 million people living with HIV, 1.1 million deaths a year, 2.1 million new infections. During the first administration that I dealt with, there was not the proper attention that was paid to it because of a number of reasons, one of which nobody perceived that it was going to be